Desperate times calls for desperate measures. At Beijing airport, children waiting to board a flight, their faces shielded with makeshift helmets. People in China are taking no risks, all too aware of the consequences of catching the deadly coronavirus. At this medical facility in Wuhan, the epicenter of the outbreak, the desperate wails of those working to save people last week speaks 1,000 words. This nurse repeats, "I can't take it anymore." This woman, in a video circulated last week too, begs to be seen. "Help, doctor, help," she screams. "I also have a fever." Both videos have since been taken down by censors. But fears about the outbreak have gone beyond China's borders. Officially, 170 people have now died from the virus. Almost 8,000 cases have been confirmed by officials, and they say 12,000 more are suspected.
There
are only 68 cases overseas, which is less than 1% of the total cases globally. This means our measures to control the outflow of the virus are effective.
Under pressure this morning, the Foreign Secretary assured Britons in China they were trying to get them out.
We've been working tirelessly. The Foreign Office, working with the Department of Health, have been working flat out 24/7 to try and make sure that we can identify British nationals in Wuhan, get them to a muster point and then get a charter flight in and out.
On the way to the airport for evacuation.
And after a full start yesterday, the evacuation is now underway. Since the outbreak, China is racing against time to build 2 new hospitals in Wuhan to meet the need caused by the virus. At the moment, hospitals are overwhelmed.
The whole city is under lockdown. The strain is on medical workers who have been working under pressure for nearly 3 weeks, and the number of patients is continuing to increase.
And it's not just in China where people are trapped. 6,000 passengers aboard this cruise liner in Italy are unable to leave as medics monitor a couple from China with a suspected case of coronavirus.
We spoke to my pregnant daughter on board. She's very agitated. She was fine until late morning because she didn't know what was going on. Then they heard the news.
19 countries have reported cases of the virus, but no one yet has died outside of China, something that experts say is thanks to a transformation learned from previous global incidents.
What's changed dramatically over the last 5 years at least is how well international cooperation has developed and all the systems that have been put in place from organisations like the WHO, but also there's a lot of international committees that bring countries together and networks that make sure that everybody's prepared for these outbreaks. So we're in a completely different place than we were, say, 5 years ago before Ebola.
As governments globally grapple with this, tonight the focus is on the World Health Organization. Within the next hour, they're expected to announce whether to declare this a public health emergency of international concern.
Anya Pop reporting. Well, joining us from Liverpool now is Dr. Nick Beeching. He's a specialist on clinical infectious diseases at the School of Tropical Medicine in Liverpool. Dr. Beeching, what will it mean if at around 7:30, which is what we think might happen, the WHO do declare this a global emergency?
Well, it will increase the way we restrict the movement of people. I think a lot of those measures have already taken place, but it becomes a much more formal measures in force to control people coming out of China and what we do with people coming back to, let us say, the UK.
What does it tell you when we learn that nobody has died outside China yet from this virus?
Well, I think that's very good news. We really don't know what the eventual mortality of this virus will be. The reports so far are quite low, about 3 to 5%, but of course the situation is changing. But we do think that many people will have a relatively mild illness, but clearly those that are older or have underlying conditions may be more at risk.
Will the virus be a fixed entity, or is it something that could evolve within the outbreak of the disease?
Yeah, so this is a fairly new virus in people as far as we know, and it is quite likely to be changing quite rapidly, both in terms of the symptoms it might cause and also in its infectivity. If we look at related viruses such as the SARS virus 20 years ago and the MERS-CoV virus, which is in the Middle East, SARS has disappeared. It came and went very rapidly. MERS-CoV is still there in the background. So it's very difficult to predict what will happen with this one.
One can understand the humanitarian desire to bring everybody home that is, abroad, as it were, and not Chinese. But what is more difficult to understand is whether it's actually a very good idea in terms of containing the disease.
Well, there has been a lot of debate about that. I think the decision has been made, and from my personal point of view, if I was one of those people, I'd be very pleased to be coming back. It's a relatively small number of people being brought back under controlled conditions and coming back to a very old-fashioned quarantine, which means observing them for the maximum possible incubation period and then releasing them if there are no signs of infection. So that group of people are going to be very easy to identify and monitor.
But the idea of keeping, say, 200 people in one place in quarantine, surely perhaps those who don't have any sign of it and may never get it might be exposed now to getting it by having to be walled up with 200 other people. You see what I mean?
You're absolutely right, but you could argue that they'd be under the same risk if they stayed in Wuhan. I don't know the details of exactly how they're going to carry out the quarantine, but they'll be monitored, I'm sure, at least twice a day for things like temperature and any symptoms. I presume that there will be a certain amount of isolation within what I understand is an old nursing home or something similar. I don't know how much contact they'll have with each other inside the quarantine facility.
Are they medicated or anything while they're there?
We don't have any specific medication against this virus, and we don't have a vaccine. The normal thing would be just to monitor for symptoms. And I would draw the distinction between quarantining people who might have been exposed to the virus and might develop symptoms. This is completely different from isolating somebody that's actually got clinical disease, and that's a different thing entirely. So this is a precautionary measure which we have applied to many infections in the past very successfully.
You downplayed the importance of declaring it a kind of global, declaring this a global emergency. But what is the significance of it if the WHO do go ahead and do it?
Well, it has a huge effect, not just on health, but on trade and movement of people, and therefore it's of immense significance to the countries that are involved and potentially to others where the infection may go to. So I wouldn't downplay that at all from the whole global view of things, not just from a medical point of view.
The World Health Organization has declared a global public health emergency over the coronavirus outbreak, after the number of cases rose to more than 7,800. Our health correspondent Victoria MacDonald is with me.
Yes, well, we have just heard from the Director General. It was a decision that had been expected, but let's just listen to what he said.
We don't know what sort of damage this virus could do if it were to spread in a country with a weaker health system. We must act now to help countries prepare for that possibility. For all of these reasons, I'm declaring a public health emergency of international concern over the global outbreak of novel coronavirus.
It was at odds to say this was not a vote of no confidence against China, and over the past week or so he has been saying a great deal about how impressed he has been with what China has done so far. But there is a problem. There are a number of cases now outside China where it's been person-to-person contact. That means those people haven't been in China and yet they have developed the virus. Those numbers are growing. We've just heard of another one in France. We've just heard of another one in America in the past few hours. What this means is not necessarily, which it can do with some outbreaks, that there will be no interference with something like international travel, but it does mean that they can call on more money and more coordination. And yet, in a funny way, there has been a great deal of coordination already over this virus. We have just heard recently, too, in the past few minutes, that the 150 people who are being flown back from Wuhan, Britons flown back from Wuhan, will land at Brize Norton sometime tomorrow, and that they will be taken to Arrow Park Hospital in the Wirral, where they will be quarantined for 14 days, staying in nursing accommodation.